Welcome everyone. If I could ask you to take your seats, we'll get started. And welcome to those of you joining us by webcast. We're glad to have you with us. We're here in London, Ontario, and the weather has treated us quite nicely today. No rain, no wind, no snow. So it's a good day, and I hope the rest of you across the country are also having a good day. My name is Catherine Madden, and I'm the Executive Director of Kidney Cancer Canada. And I just wanted to take a few minutes to welcome you and share a little bit of information about who Kidney Cancer Canada is. Then we're going to have some really great speakers. We're going to hear from Devon, who's going to share a story about her journey. We're going to hear from Dr. Potler and Dr. Potvin about management of early stage kidney cancer and medical treatment of kidney cancer. And then we've got Laurie Sachs and Paul O'Brien, who are going to co-present with one another issues about managing side effects of treatment. And then we're going to have a question and answer period, and then I'm going to come back and sort of wrap it all back up for the rest of the evening, and hopefully we'll have a little bit of time for some questions and some camaraderie. So thank you for coming tonight. So Kidney Cancer Canada was founded in 2006 by two patients, one of whom is in the room, Deb Maskins. And we are the first and only Canadian charitable patient support and advocacy organization focused exclusively on kidney cancer. Deb and Tony met in a waiting room and realized that there needed to be more for people dealing with kidney cancer, and so our little organization was born. Oops, using the wrong clicker. We are a growing patient and caregiver community. We've grown from those two patients who met in 2006 to just at 2,207 patients and caregivers and family members who are part of our community now. And we have a mission to improve the lives of those affected by kidney cancer across Canada in several ways. That's about providing support and education. It's about raising awareness. It's about raising funds to support research and advocating for patients so that you have access to treatment and the best possible care. Behind the scenes, our organization, we consider ourselves lean and focused. I wish I were a little more lean, but we're focused. I am the only full-time staff member, and then we have two part-time admin coordinators, one in Quebec, who helps us with our French language calls and translation and works in the province of Quebec to increase awareness for us. And then Michelle Sudeiko, who's here in the room, who you probably met at registration, who works with me in Ontario and helps us with coordinating patient education meetings like this, generating our charitable receipts, doing some of the administrative work of the organization. We have a working board of directors. They are patients, caregivers, and professionals. Deb was our former chair. She's now assumed the role of Director of Medical Relations. We have Wally Vogel here, who is our IT guru, helping us with our webcast tonight, so thank you to them. We have at least 80 or more volunteers, and when we did an analysis in 2012 of the number of hours that were contributed to our organization, it numbered over 38,000. So that's the reason we're able to accomplish as much as we are in such a short period of time. We have an amazing group of volunteers who support this organization, and we certainly wouldn't be here without them. We are virtual. We all work from home offices. There is no head office, no main office, and that works well for us. We have our board meetings via conference call and come together twice a year face-to-face as a board to plan and strategize and ensure that we're delivering the services that patients and their caregivers need. We are highly respected and credible in that we have a medical advisory board of 19 of the top specialists in renal cell carcinoma. And we have an active Kidney Cancer Canada Nurses Network, a place where nurses can go and connect with one another to share information, ask each other questions, and get peer support as well. And we are both funders and collaborators with the Kidney Cancer Research Network of Canada, and they are looking at a variety of areas, the four key ones being survivorship, genetics, personalized medicine, and quality of life. Our shared objectives with patients, caregivers, the industry, and other stakeholders is access, of course, to all approved treatments for kidney cancer, and that's regardless of your insurance status or your place of residence. We want to ensure increased awareness of all of the treatment options that are available for RCC with patients and with the physician community. We want consistent and high-quality standards of care throughout Canada, improve patient quality of life through support and dissemination of information, and we want to ensure increased funding for kidney cancer research. For patients, caregivers, and others, which is really why we're here tonight, We have a website in both English and French. It contains a great deal of information to educate and support you and provide hope. We have an interactive map and a discussion forum, which I'll talk about a little later, which is an opportunity for you to connect with others. We have peer support both online and by telephone, so if you need to talk to somebody as a patient or as a caregiver, or one of your family members needs to talk to somebody and has questions, we're there to help. We have patient education meetings like this one tonight, 6 to 8 times a year, and we are webcasting them all now, and then we post the videos as well on YouTube so that everybody across the country has access to this information as we get it. And we will be having our National Patient Conference on March 29th of next year in Toronto. This year we were in Vancouver with about 160 people in attendance for the day. We have all sorts of information. There's information available on the website, so please take a look at that if you're interested in joining us there. So our website, as I said, we've got a discussion forum where you can go online and ask questions, or you can just lurk and read what other people are talking about. You can also take those conversations offline and talk to somebody. If you have a question but you really don't want to put it in a public forum, you can connect with somebody who's posted on that discussion forum, reach out to them and ask them for some help. We have our interactive map, which you'll see a shot of shortly, and it's an opportunity to put yourself on the map to show a sense of community across the country and in your own local community so that people understand that they are not alone on this journey. It sometimes feels that way because it is, it's a disease that doesn't affect as many people as the breast cancers and prostate cancers of the world, but the reality is feeling part of a community and connected to others is important on your journey. We list a variety of clinical trial updates. They actually were just updated this week, so that information is there and updated on a quarterly basis. We have educational videos as well as the videos for meetings like this, questions for your doctor, top 10 tips for survivorship, great deal of information. And if there's anything there or not there that you'd like to see there, please let us know, because we're always wanting to add content to be sure that we're reaching the needs of our patient and caregiver community. So some of our publications, we have a general information brochure. We have a poster that hopefully some of you have seen maybe in clinic or in your doctor's office, and it's an opportunity again just to create outreach to folks. We have a newsletter that comes out twice a year, and then a variety of other publications that we can share with our patient and caregiver community. So for more information, hopefully most of you probably have been to the website, you registered in advance, so that's a good thing. But if you haven't had a chance to look at the website, please take a chance, poke around, see what's new, and check back often, because we're constantly trying to update and keep the latest, most current information available for you. And leave us your contact information if you'd like to be added to our mailing list or receive additional information. And then for those of you who are on Twitter or Facebook, please follow us, tweet us, retweet us, like us, share us. That's the way that we really create awareness across the country and create that virality that allows us to increase our reach to patients. And then YouTube is our channel where we house all of our videos. And then we have a WordPress blog that is updated when there are sort of timely, important issues to talk about kidney cancer or treatment options or key items that are important to people on this journey. Just to quickly review tonight's program, as I said, we've got some great speakers coming up. We're usually pretty good about keeping to time, and then we'll have a question and answer period at the end. Deb Maskins is going to moderate that for us. Then I'm going to do some closing information about how we can help you, and then an opportunity hopefully for some networking and refreshments and questions if you have them. So please feel free to talk to any of us who are here tonight if you've got a question or something that you'd like to know. Thank you.